Hello, so this is about co-occurring disorders. The term co-occurring disorders refers to a condition in which an individual has a coexisting mental illness and substance use disorder. While commonly used to refer to the combination of substance use and mental disorders, the term also refers to other combinations of disorders, such as mental disorder and intellectual disability. The term dual disorder and dual diagnosis were previously used to describe the same condition. When a substance use disorder and a psychiatric disorder co-occur, they may differ in severity, and the severity of each can change over time. A relapse into substance abuse can worsen psychiatric symptoms. Psychiatric decompensation can also leave a person vulnerable to addiction relapse. Common examples of co-occurring disorders include the combination of major depression with cocaine addiction, alcohol addiction with panic disorder, alcoholism and polydrug addiction with schizophrenia, and borderline personality disorder with episodic polydrug use. Sorry, checking my bearded dragon. Anyway, it is important to note that a client can have one or more mental disorders and one or more disorders related to substance abuse. For example, a client can be diagnosed with bipolar disorder and borderline personality disorder. This client could also have alcohol dependency and cocaine addiction. For individuals with more severe or disabling mental disorders, not disturbing, disabling, as well as for those with developmental disabilities and traumatic brain injuries. The threshold of substance use considered as harmful is significantly lower than for individuals with such disorders. It is important to note that the chronic use of an illicit drug still constitutes a significant issue for treatment, even when it does not meet the criteria for substance abuse. Compared to individuals who have a single disorder, those with a combination of disorders may experience more severe medical and mental health challenges, and may also require longer periods of treatment. So symptoms. The symptoms of co-occurring disorder include those associated with the particular substance abuse and or mental health condition affecting an individual. People with co-occurring disorders are at high risk for many additional problems such as symptomatic relapse, hospitalization, financial problems, social isolation, family problems, homelessness, sexual and physical victimization, incarceration, and serious medical illnesses, such as HIV and hepatitis B and C, suicide, violence, and early death. Any one of those problems can complicate the treatment of co-occurring disorders. Causes. Mental health and substance use disorder results from a combination of factors. Certain people have a high genetic risk for such disorders, but one's environment can also contribute to the risk. People with mental health disorders are more likely to have a substance use disorder than those who do not. Roughly half of the individuals who have either a mental illness or substance use disorder will have the other at some point in their lives, according to the National Institute on Drug Abuse. It is unclear whether people develop mental illness first or substance abuse disorders first. Sometimes the mental problems occur first. This can lead to people to use alcohol and or drugs that make them feel better temporarily. Sometimes the substance abuse occurs first. Over time, that can lead to emotional and mental problems. According to the DSM-5, an increased risk for alcohol use disorder, for example, is associated with conditions including bipolar disorder, schizophrenia, and antisocial personality disorder. An alcohol use disorder may be related to certain anxiety and depressive disorders. Other substance-related disorders also commonly co-occur with distinct psychiatric conditions, as in the case of opioid use disorder and depressive disorders. It is possible that the substance use problem leads to the development of the other mental health challenges, or that it worsens a pre-existing disorder. Treatment. To provide appropriate treatment for co-occurring disorders, the Substance Abuse and Mental Health Service Administration recommends an integrated treatment approach. Integrated treatment involves coordinating substance abuse and mental health interventions, rather than treating each disorder separately without consideration for the other. Integrated treatment often involves forms of behavioral treatment such as cognitive behavioral therapy or dialectical behavioral therapy that can help improve coping skills and reduce maladaptive behaviors. These may be used in combination with medication. Treatment may also entail a collaboration between clinicians and organizations that offer support to handle issues related to housing, health, and work. As a part of the program that treat co-occurring disorders, psychosocial education classes can help increase awareness of the symptoms of disorders and the relationship between mental disorders and substance abuse. Relapse prevention education can help clients become aware of the cues that make them more likely to abuse substances and help them develop alternate responses. Dual recovery groups located on treatment sites and off-site can also play a role in recovery by offering a supportive forum for the discussion of psychiatric symptoms, medications, substance-related impulses, and coping strategies. So that's it for this video. Thank you for listening.